Biological Institute. I'm Dr. Shravani and I'm delighted to be your host on our show. We Talk Do, where we focus on spreading awareness about various conditions related to human reproductive health through expert advice from specialized medical professions. I would like to take this great opportunity to introduce our company HBI. Human Biological Limited is an initiative of Indian Immunologicals Limited. It was IL was established by the National Dairy Board (NDDB) in 1982 as its unit and later registered as company in 1999 with name Indian Immunologicals Limited. HBI was established in the year 1998 when the Government of India requested IIL to produce an modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Uti. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in 2000. Subsequently, HBI launched other vaccines and currently we are the major player in human vaccines. Leader in ARV segment and present in around 60 countries. 3 state-of-art manufacturing facilities at Uti, Gachibowli, and Karkapatla. HBI has forayed into the market of clinically proven wellness products and infertility range of hormones. Our vision is shaping global healthcare by spreading the One Health initiative, and our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. We believe in providing affordable products and high quality through continuous technical innovations and improvements to meet our customers' need. As a market leader, we have been significant step to reduce the plastic burden by 160 tons per annum by introducing eco-friendly packs for our flagship brand Abhairab and Abhairab PF. As a corporate social responsibility, we have adopted schools where IL is providing infrastructure and basic facilities, including in helping midday meal program in association with NDDB through our gift milk program. Hundreds of school-going children are benefited daily, and we have also donated oxygen generation plant to Telangana Institute of Medical Science in Gachibowli. There are few information about IL. For more information, these are few information about IL. For more information, you can also log into our social media platforms with www.indyimmune.com. Thank you for joining us today. Let's get started today talking on understanding menopause and overall well-being. Menopause describes the stage of woman life with her menstrual period stops permanently. Many myths surround menopause, including the belief that it only happens after age of 50, that hot flashes are the only symptom, that you can only then you cannot get pregnant after that. Menopause is a disease and so on. There are so many myths and facts about the menopause. To explain menopause in detail and discuss, we are honored to have Dr. Devanshi Gupta, a renowned infertility specialist with vast clinical and surgical experience. Dr. Devanshi Gupta holds MBBS MS in obstetrics and gynecology, currently practicing in London. Welcome, Doctor. Short video clip by IL. I'm welcoming Dr. Devanshi Gupta with us today and talking on the understanding menopause and overall. Welcome, Doctor. Good afternoon. Thank you for joining us today.
Thank you, and thank you for the warm welcome.
Thank you.
It's my pleasure to join you.
It's equally our pleasure, ma'am, that you are joining with us today. Ma'am, before starting about the menopause, our like generally women have so many myths and facts, so many stories, and so many questions and queries. So before we just want to understand what is menopause and stages of menopause.
Okay, so as you, I'll be glad to share you with the one thing which is other than the topic. That now I am a certified menopause practitioner also. So I've cleared that exam and got the degree. And now coming back to the topic. Menopause is basically a physiological event which occurs in the lives of all women, and it is a transition from reproductive period to a non-reproductive period. Basically, it is a process of nature in which nature protects the morbidity in the women by making her non-reproductive in later half of the part of her life. So, stages of menopause, as we all can say, there are various classifications that, like, there's answer clear. Like, general public need not go into details of those classifications. For their better understanding, I can classify it as perimenopause, menopause, and postmenopause. This is like a simplest classification in which perimenopause area consists of 3 to 5 years before the menopause is arising. Menopause is defined as final menstrual period, which is like 1 year back. So, menopause is a retrograde diagnosis. Once you get your menstrual period, and after that, if for 1 year you don't get any period, that means that was the date when you attained menopause, but it is a retrospective diagnosis. So, perimenopause can range 3 to 5 years before uh, to 1 year after menopause. Okay, and then there is a period of post menopause in which there is a decline in the health of the females. So, these are three things. Okay, perimenopause and post menopause.
Okay, ma'am. Ma'am, we also wanted to know menopause has different types of symptoms, but what are the common symptoms what menopause lady or pre, post, or peri woman has the same symptoms or the different kinds of symptoms?
See, menopause is normally in general public people think only vasomotor symptoms, that is hot flushes is one of the symptoms. But menopause is very vast. It ranges for matlab, abnormal uterine bleeding, like irregular bleeding, may it be heavy bleeding or little bleeding. Then bone loss occurs, muscles get weak, quality of life gets affected, sexual life get affected. Even there is a psychological so much effect on the women because of less estrogen. And also there is they are more predisposed to cancers, and we have to look into that aspect of the lady as well. So it is like short term effects like bleeding and vasomotor symptoms, emotional content, decline in fertility, and all such things. And mid quality, that is bone loss, is the major concern, muscle loss, memory power, like Alzheimer's, and then cancer risk is a long term consequence of menopause.
Okay, ma'am. Like how long this menopausal symptoms are seen, ma'am? Like is it forever or it's a time being like a woman is like seeing these symptoms?
So it's not forever, and it depends on the symptoms. Like vasomotor symptoms might last in start in perimenopause, like 1 to 2 years before menopause, last 1 to 2 years after menopause. But then bone loss, the thing we are talking about is it'll start from menopause and gradually keep on declining until unless we intervene, and the women is herself very concerned about it and she goes to the doctor. And the every symptom has its own time limit. It's not like anything can go on forever. But yes, some start at menopause and continuously decline, and some like vasomotor symptoms, mood changes, hot flushes, they may go after 1 to 2 years only.
Okay. Ma'am, any factors that influence a menopause, like getting early menopause, like usually we hear early
Yes, there
puberty and
are.
all. Do we hear like a early menopause also?
Yes, there's so many factors which affect menopause. Your multiparity, multiparity means your birth status, like how many children you have. Then at what age was your menarche? If it was menarche earlier, then your menopause might also occur early. Then your mother, at what age, what genetics is running in your family. If your mother had
Okay.
an early menopause, you might get an early menopause. Then there are many other surgical or iatrogenic factors, like suppose a female is having so much endometriosis, some chocolate cysts, some ectopic surgery being done, hysterectomy being done at an early age. So that will cause to surgical menopause. And in general, like if she's obese or something, they might have a little delayed menopause because of obesity is a negative this thing. And all the fact there are many factors, it is multifactorial, which depends how your menopause will be.
Okay, ma'am. Like any diagnostic test or assessments are typically used to confirm menopause. Like I may get this menopause in this age and all, because
See there.
usually women have this. It's a very big taboo or scaredness when you are in 40s, mid 40s and all. The woman will be thinking like I'm going to get perimenopause now. So how like now this is the era of getting diagnostic tests. So can you please mention any few tests?
See, basically, menopause is a whole lot of syndrome. It extends for 10 years. So, how will you do it? And
Yes.
there are definitive diagnostic tests, but they are not needed. Basically, it's a clinical diagnosis. Still, in case somebody like insist on getting a test done, you can test a serum FSH level, which is a hormone, follicular stimulating hormone, which is secreted from the brain. And if levels are more than 20, that she is in menopause, and more than 40 is like confirmed menopause, which has already set in. Then there are some ovarian, like proxy markers, we say ovarian reserves, AMH. If AMH is falling very less than 0.01, it might be due to other factors also. But if it is a woman was previously normal AMH and now her AMH has decreased so much, so it is another diagnostic test. But basically, for menopause, what we say is clinical diagnosis, because it is 1 year. I told you it is a post retrograde diagnosis. 1 year
Yes.
post last menstrual period is the menopause.
Yes.
So if women and then women too much insist on diagnostic test, she can get her serum FSH and AMH done.
Okay, ma'am. Ma'am, like any lifestyle changes that implement, like elevate the menopausal symptoms, or like does any lifestyle changes a woman has to do?
Yes, this is the mainstay of the treatment. Everyone is turning to this, and it is very important. I suggest it is more important than taking any medicines or something. Women have to be alert. Like, I don't think they should be alert in perimenopause period. They should be alert in their reproductive age as such. They
Yes.
should start now, start exercising, taking calciums, taking vitamin D, going for a walk, building on your bone mass, building on your muscle mass. All these things will help in your easy transition from in menopause. And if you are already in menopause, please try to lose weight, to make a healthy lifestyle. There's so many morbidities which kick in once your estrogen falls. Everybody knows that women, once their estrogen falls, then they are at high risk of cardiovascular disease. Then there is like their risk of fractures increase because of low bone mass. Okay.
Yes.
And then their dementia occurs, so they should start like brain exercises and all those things. And lifestyle starts from eating, exercise, and the way they sleep, and taking care of the body. Even one more factors which we are forgetting is postmenopausal women are mostly diabetic, so they need on control on their diet, and all such things is very important.
Ma'am, like this era is like, all the women are working. Almost everyone is
Yes,
working. We have a
yes,
very hectic schedule. Like we say that we have a hectic schedule and we delay. We don't exercise or eat diet properly. So
very important.
yeah. So thank you for saying that. Lifestyle modification is key for everything, and it's a good explanation too. Any other treatment options for medical treatment options for the menopausal symptoms and all, like managing symptoms?
See, treatment options are very varied, and you need to consult your gynecologist for that.
Yes.
So, according to your symptoms, she might prescribe you, she might do some test. Like if you have an irregular menses, let's start with the very first symptom of irregular menses. If you have irregular menses, then she might test that what are the causes. Is it just because of menopause, or it is due to underlying some cervical cancer or something which is more serious of that sort. So first is the treatment will be according for menopause. If it is only due to menopause, then depending upon your condition, she might suggest you hormonal supplements or suppression or anything like that. There are many conditions which, like some of the ovarian cancers, which are more common in post-menopausal age group. So we need to rule out for that also. Then coming to vasomotor symptoms. Vasomotor symptoms might be very easy to say, but they're very troubling for some of the females. They might think that when the hot flush strikes in, she feels perspiration, palpitation, some panic also some of the females get struck with. And then, and if you just like, it's not the late years like they say ki ha satya gaye ho like that. Nothing like that. We have the treatment and we can give the hormone replacement therapy. Nowadays very nice hormone replacement therapies have come, and some studies are showing that it is safe to use, so we can give that in that. Then coming, always when a menopausal lady comes, we need to assess her genitourinary symptoms also. Many of them suffer from leaks. They don't go to social events and this thing because of urgency
Yes.
and the lack of pelvic muscles. So we need to guide them through that exercise also, and do a corrective measure. Suppose they are diabetic, then they get infection, and plus menopause, so their genitourinary symptoms itself are very distressing for some women.
Yes.
And I would like to inform with you, using your platform, that it is treatable, and it is very well, like if you implicate all three measures, like the exercise, diet, and drugs. There are few medicines which are available which will release your bladder, like relax your bladder and all those things, so you can get relief from those symptoms. Then coming to the longer symptoms, like there ought to be changes. Our environment should become the more menopausal women friendly, like elderly friendly, we can say that. That in the house, if there are areas, tiles where there is more like tendency to slip, then we can replace them with a little rougher floor. Then there should be handles at the side of toilets and something, so which they can catch on. And all those like structural changes also need to be done. And then changes at the level of the patient itself is also important. So
Thank you, ma'am. Thank you for saying, like, even, the woman is always judged with the PMS and menopausal symptoms. Whenever we have like, even ladki or like, when they get angry, then they say, usko PMS ho raha hai,
हाँ,
menopausal symptoms ho raha hai. There's a big, in the society, we are judged for that. But everyone should know that it's common and every woman undergo that. Thank you
yes,
for saying that.
it's not a disease, it's a physiological changes. And
Yes.
as supportive as we can get as doctors, as peers, as the family members, it will be very easy for the women to glide through her menopause.
Yes, ma'am. Thank you, ma'am. Ma'am, what are the nutrition? Are you already mentioned lifestyle and all? So, like, can you anything recommend for the nutrition aspect? Like, any how should we what all she has to include in her diet so that this symptom, diet is a main key also. So, can you please
Yes.
enlighten on?
Yes. one important thing is that diet is very major role in this menopause, especially for bone we are talking, because I'm talking too much about bone because fragility fractures are very common post menopausal. Either your dadi or somebody in the history, elderly women will have some neck femur fracture or Achilles fracture, which that is fragility fractures when the force of the fracture is not enough to cause fracture. Like standing, if she falls she'll get a fracture.
Yes.
So very important to include high calcium diets. Calcium, what are the good sources of calcium? Are milk, till, which our grannies used to eat, but we don't eat. So we need to include all such high calcium diets in our, like till will be very good, milk, curd. If they are taking non-veg, they can take eggs. All those things are good sources of calcium, and they should take that. Other than that, soy products like proteins, soya flavins, so they are like phytoestrogens are rich in that. So they once your body has less estrogen, if you are consuming soy products, phytoestrogens are going through the soy products, then you can get an easy transition. Isoflavins and all will help in your menopause. Other than that, most important is make a protein rich diet, because if you don't consume enough protein, your muscle will go into wasting. So, and it is very important for a menopausal lady to retain her muscle mass. To grow is becoming difficult day by day because of a decreased estrogen and progesterone
Yes.
female hormones. So at least try to retain your muscle mass. So calcium rich diet, protein rich diet, diet with isoflavonoids, all these things in good hydration, good personal hygiene, all such things should be maintained in diet.
Sure, ma'am. Thank you. Thank you for this. Ma'am, like as you mentioned, calcium is a major supplement, vitamin D is a major supplement. Like we have a doubt that some doesn't know that how long we should take, that menopausal lady should be taking these supplements forever, or like how should we, any recommendations for that?
There is a recommendation of doing bone marrow density,
Okay.
BMD, but it is not for all. Maybe post menopause 5 years everybody should get it done, specifically of a hip area or the vertebral area. If bone marrow density is measured in the T scores, if it is less than minus 2.5, that means she is severely deficient. She
Okay.
need to go for proper treatment, and all orthopedicians these days will be using bisphosphonates or some type of agents to increase the bone marrow density and giving them calcium supplements.
Oh.
Another, if you are not in the age of this thing, like not in that osteoporosis range, then it might be minus 1.5 to minus 2.5, that is osteopenic range.
Okay.
In that also supplements are needed. But if your bone marrow density is not all that low, you have been very healthy through your reproductive period, it is less than 1.5, only dietary supplements are enough. So how much to be given can be decided specifically on bone marrow density, but it is a costly marker, and
Yes.
in India cost is very important. So
Yes.
we can give them on and off like calcium if they are not taking. If their diet, we should ask, spend time on asking how, what is their diet, and if we find their diet is lacking in calcium, we can always supplement them.
Thank you, ma'am.
So
Thank you for letting us know this. Ma'am, you have explained menopause and overall well-being so well that, the tiny, tiny aspects and all, it's very elaborative and informative. We have few questions from our viewers that, as you mentioned, treatment for menopause can be treated with the hormones. Are hormones safe?
yes, there was a WHO trial, sorry, WHI study, which had some controversial results, and they told that hormone replacement therapy is not safe and it will increase the cardiac risk. But it was not properly like blindfolded, and not properly, the study subjects has not been chosen properly. And now there are many studies which suggest that hormone replacement for short period of time, that is within less than 5 years, from the final menstrual period. Like in early menopause, we can supplement with hormone replacement therapy, and it is definitely safe. It should be initiated very cautiously, specifically in cases of vasomotor symptoms and genitourinary symptoms. Other indications for starting hormone replacement therapy are not certified. Like for bone loss or something, we are not starting her on estrogen. We are giving her bisphosphonates, calcium, and all those things. So for perimenopausal bleeding and all, we are not just straight away putting her on hormone replacement. We are first analyzing her risk for cancer, cervical cancer, ruling out all the other kind of cancers. And in case the menstrual disturbances are only due to the menopause, we are putting her on HRT. So careful selection of the patient for which we initiate HRT, it will be beneficial and it will have minimal side.
Okay, ma'am. Thank you, ma'am. Ma'am, next question. Like the woman previously got in any fertility treatments, will she get early menopause?
No, it is not like that. Ki if anybody has got a fertility treatment, it might be a case that a patient was already a patient of premature ovarian failure. That's why she has to undergo fertility treatment. So it depends on the reason why she has to undergo fertility treatment. Was she was prematurely aging, then she might get a premature menopause. For your information, like premature menopause, what we call is at 46 age is considered as an average age of menopause in India. Less than 6 years, like less than 40, if somebody is attaining menopause, we call it premature menopause. And more than 52, like plus 6 years, if somebody is attaining menopause, we call it delayed menopause. So it is not as per fertility treatment per se. There might be many factors compounding her lifestyle, her previous status, maybe her ovaries had to be removed because of endometriosis. Might be so many other causes which compound to menopause.
Okay, ma'am. Ma'am, the next question is like any skincare tips for menopausal ladies?
Skincare tips. It will be good hydration, good vitamin D. I think vitamin D is overrated, is recommended in everything these days. And then if you are healthy from within, then I think it'll be good. High protein diets. I have no idea about glutathione, which is being indicated these days so much. From my side, it will be vitamin C, vitamin D, and good protein content.
Thank you, ma'am. Glutathione is everywhere.
Everywhere and hydration.
Yes, ma'am. Thank you. Thank you for mentioning that. Ma'am, thank you so much. There's so many questions bombarding, but thank you so much for joining us today, giving information about menopause and helping our ladies through our platform. I'm sure, like, whosoever is watching this video and now and would be watching this in the future will be benefited with all the suggestions and insights given by you today. Uh,
Thank you.
Thank you all the viewers joining us today. Before we end this video, ma'am, can you please give three takeaways for our viewers?
First is menopause is not a taboo. It is a natural physiological event which occurs in all females, and we need to be supportive. We as females should be more careful of ourselves. We need to take care of our diet, our exercise, start building our own bone mass and muscle mass from the reproductive age as such. Like early 30s is the very good time when we invest in ourselves. And wishing everybody easy transition through menopause.
Yes, thank you, ma'am. Thank you, and we wish you a happy Women's Day, as the Women's Day is like on coming on March 8th.
Hmm.
You're like doctors like you, women like you, empower all the women around the world. Help educate them. Thank you for being us with today, enlightening so much about menopause.
Yeah.
Thank you, ma'am.
Thank you. Thank you so much.
Thank you,
It
ma'am.
was
Thank
very
you.
much I had a nice time talking to you and answering the questions. I wish we could take some other questions if we had time, but thank you so much.
Thank you, ma'am. Thank you so much.